Now, for those parents who haven't taken their child to an allergist yet, maybe they've been mainly seeing their pediatrician so far, are there things that they can do to get the most out of that first visit?
Number one thing parents can do is bring the old records. So if an allergist is seeing a patient who's been followed by the pediatrician for several visits, it's nice to know what happened at those visits and to actually see, what medications have been tried, if any allergy blood testing has already been performed, and how many exacerbations have occurred, over the last few months or even over the last year. So that's the first bit, to kind of come prepared with what's already happened. I think it's also important to come with a list of questions, so that first visit you can get educated very much about the diagnosis. I find that my patients who are a little bit more empowered, letting themselves with their knowledge of the disease, education, and asthma action plans, they take control of the asthma rather than letting asthma control them. I also think being prepared for the allergy test, knowing what kind of testing may be done, whether it's skin testing or blood testing, and then sitting down with the doctor after, maybe breathing tests are performed, an allergy testing is performed, and then again, getting a good summary from the allergist and having a time to have follow-up questions. If a patient comes and already has a diagnosis of asthma, that's one thing. But if you're suspecting asthma and come to the allergist the first time and the allergist is the one who diagnoses the asthma, it can be a long visit and it can be overwhelming. And sometimes patients will leave and they'll have follow-up questions. So I always schedule a follow-up pretty quickly after the first diagnosis of asthma so that parents and even patient questions can be answered appropriately.
I know parents can be overwhelmed by the asthma, and certainly kids can also. Are there things that you would suggest or advice that you can give for parents in talking to their kids about the asthma?
Well, I think, again, letting the parent and the patient control the asthma and not letting the asthma control them. I think that's an important message for the child to hear. You can control this, that it is something you have, but with proper avoidance of allergic triggers and proper medications and knowing what the symptoms are, knowing what to expect, again, you can have a normal life. Don't let asthma control you. When I see asthmatics, oftentimes I'm asked, well, should my child stop going to recess? Should they stop going to physical education class? Are they not allowed to be at their friend Johnny's house who has a cat? And my goal with asthma therapy is for the patients to have as much of a normal life as possible. So I think that's an important message for the physician as well as the parent to give to the child with asthma. I think having an asthma action plan on hand is of utmost importance because it lets the parent and the child know what's coming, know what to expect. If I wheeze, this is what I'm going to do. If I'm in more trouble than a slight wheeze, then I know I'm going to do this. Knowing the plan of what to do when symptoms occur, I think gives patients, again, that empowerment, and then I think they take better control of their asthma.